country doctor claims he's managing to keep 3/4 of all the patients he sees out of hospital by providing backup to paramedics. It's believed the scheme, which runs across several West Midlands counties, is saving the NHS millions of pounds a year. Our health correspondent, Michele Paduano, has been to see the work.
Dr Marc Crutchley grew up 2 streets away from the fire station in Wolverhampton, where he's now based. After working all over Britain, he's come home to help, attending calls with paramedics.
Fighting for the breath, seeing's fine, chest and upper back pain.
Today it's a 40-year-old woman with a suspected heart attack.
Your oxygen levels are 100%, okay? So you're breathing a little bit too fast, but you're absolutely fine, okay?
I can't feel my feet.
You've just got to slow your breathing, that's all.
The woman is eventually put into the ambulance and put on a heart trace, but there's good news.
Mark can assess her and ask her if she needs any, the scope of sort of medication or a prescription for something, or even referral to her own GP. And if that's okay, yes, she can be discharged at the scene then.
Eventually she's recovered enough to be taken home without the need to go to hospital. Back at the station, in a brief break, they reflect on the work.
Unfortunately, some people fall through the gaps, really. And those are the people that we're seeing, and when you multiply that over a large area like Wolverhampton, that's a lot of patients, really, that are going to A&E that don't need to go to A&E.
Another job, this time a man in his 60s with kidney pain who doesn't want to be seen.
There's nothing new about doctors working with paramedics. Staffordshire Ambulance Service introduced this many years ago. What is important is this working closer together, blurring the lines between different parts of the NHS, which is going to be vital if the service is going to survive.
If you've got abdominal pain, you have to go into hospital. You have to be seen by a doctor. So there's certain policies that the paramedics have to follow, and that was one of them. So it worked out perfect in this case.
And for the second time today, an ambulance can get back on the road rather than sit outside accident and emergency.
Is that you returning, please?
Roger, return, thank you.
Michele Paduano, BBC Midlands Today in Wolverhampton.